Hi there, my name is Tori and I'm a yoga teacher. I'm also coming up to 6 weeks post ACL surgery. This is a short class that's designed to start bringing mobility and strength back into our practice. I have to say though, first of all, I am not a doctor, but I'm not a physical therapist. I've been working with my health practitioners to help put these together in a safe way, but it's always important you talk to your health practitioners prior to starting these sort of lessons. All right, so today's practice, we're going to start on our back with your feet down on the mat distance apart, and we're going to allow our knees to start to knock together in the middle. Throughout today's practice, I will be wearing my brace. I have it at full openness for mobility. If you're not able to bend your knee past 90 degrees yet post-op, you can check out some of my other videos, but today's practice will not be for you. All right, so we'll start off letting our knees knock together, shutting your eyes down, and maybe you place one hand on your chest, one hand on your belly, and just start to tune in where you're at right now. Maybe you've had a busy day, or maybe your day is just getting started. Maybe you have a lot of things rushing through your mind, or maybe you're starting to waken your body and your mind up. Wherever you're at, just observe this. Begin to bring your awareness into your breath. Deepening your inhales and lengthening your exhales. A lot of time in our yoga practice, we like to set an intention. Right now, I'm focusing my yoga practices on acceptance of my body. Not wishing it to be how it was before I had the injury, not looking forward to where I'll be in 6 months. Just practicing acceptance of where we are right now. Take 2 more breaths. And then we're going to bring our feet in line with our hips. A lot of times when we get ready for bridge pose, we want to be able to brush the edge of our heels, but today we're just going to make it that we're in a comfortable position. I am feeling a bit of tension in my knee, but it's nothing too painful. Hands come down next to the hips, and inhale, press your hips up, coming into bridge pose, opening the front of the body and beginning to warm up our quad muscles. So while we're rehabbing our knee, the main focus points that we're trying to regain strength in is in our quads, our hamstrings, and our glutes. So that's what we're really going to be focusing on today, is starting to fire up those muscles again, bring some movement into them, and start to strengthen the leg. On your next exhale, slowly lower down onto the mat. And we're just going to let our knees shift from one side to the other. Come back to center. See if you can just scoot your heels up a little bit again, and inhale, press up through the hips, coming into bridge pose once again. Option this time to take your hands underneath your shoulders, just to give a bit more extension, opening in the chest, pressing up through the legs. Release your hands and slowly come back down onto the mat. And we're going to draw our knees into our chests. With your non-injured knee, you might be able to pull your knee up towards your chest, but for the injured knee, we're just going to keep it at a comfortable angle. This is more about bringing our quads to our torso than bringing the knees in. So just bring your knees up. Maybe we'll do some circles around one direction and then the other. Now we're going to reach between our legs, grabbing the outside of our feet and coming into happy baby. Just notice where you're at right now. If this is feeling any discomfort, bring your feet back down onto the mat. But if you're feeling good here in happy baby, take a moment and just enjoy this pose. Again, starting to open up our legs, bottoms of the feet pointing towards the ceiling, knees and quads being drawn down. If you like to bring some movement in here, you have that option. Release your feet, bring your hands behind your hamstrings, and we're going to rock into a seated position. So I still don't really have ability to get onto my knees yet, so that means no tabletop for us quite yet. Not sure when we'll get there. But we're gonna come into reverse tabletop now, just to warm up the arms and start to bring some opening into the legs and lower body. So hands come just next to hips. Inhale, press up into reverse table, chin being tucked into your chest. Engage your core muscles. And then slowly lower back down. And we're gonna make our way into downward dog. There's not any graceful way to do it right now, but we're just gonna make our way there in the way we can. So once you're in downward dog, take a few moments here to stretch out, walk out your dog. And we're gonna bring a nice deep bend into the knees to really tilt your pelvis up towards the back corner of your room, lengthening your spine. Shift your weight forward, coming into plank. We aren't going to be in plank an awful lot today, but whenever you are, you always have the option to bring down your non-surgical knee. Bend your knees, shift your hips backwards, and then straighten your legs back into downward dog. Weight shifts forward to plank, bend the knees back, and lift the hips. Take a couple more rounds of this mini flow. Shifting forward to plank, bending the knees back, and lifting the hips. Come up onto your tiptoes and walk to the top of your mat in a forward fold. Let your head hang heavy. Shake your head back and forth. And inhale up into a halfway lift, lengthening your crown of your head forward. And exhale back down. Inhale slowly, coming up to mountain pose, hands to heart center. All right, we're gonna do a nice little flow here. The first round will take a bit longer and then we'll speed it up a little bit. Start to bring your attention into your left leg. For me, that's my non-surgical leg. So if you're the opposite way around, I'd recommend starting with your non-surgical leg and just swapping around my directions in your head. So we're gonna bring our weight into the non-surgical leg, my left leg, and right leg comes up into one-legged mountain. Got a nice bend in my knee here. Find your focus point. And then we're gonna bring our right leg behind us, reaching out forward, coming into warrior three. Here for 3 more breaths. We're even moving into a high lunge, so your right leg's gonna gently come down onto the mat in front of you. Inhale, arms come up high. Take a moment to settle here, feeling the strength in your body. And the energy coming out through your hands, all the way reaching up. Open into warrior two. This transition can be a bit tricky since we are rotating our foot, so just be careful to keep the right leg engaged and supported while we make that transition into warrior two. Feel a nice deep bend into your left leg, gaze over left fingertips. Inhale to reverse warrior, opening up the left side body. Inhale back to warrior two. Straighten the left leg, reach forward with your left hand, and we come down into triangle pose, Trikonasana. Option here to use your block for support underneath your left hand. Inhale back up into warrior two and into reverse triangle. Reverse warrior. Come back into warrior two, grab that block that you've got, and we're gonna make a bit of a tricky transition here coming into half moon. So the right leg's gonna come up, hips are stacked, right leg up, right arm up, using the block for support. Our next move is moving into standing splits. And this is going to be when we're going to come back to accepting where our body is right now, not where it used to be and not where we want it to be. So hips face down, Hands come onto the mat and the right leg reaches up into half splits. I'm going to keep my hands on the mat. If you have in your practice to come and try and do a balance holding onto your left leg, please take that opportunity, but that is not in my practice right now. We're going to bend the right knee and bring it behind the left, coming into a Shiva squat. Exhale, extend up. Inhale, squat. And extend. Back down to our last squat. And extend. Lower your right leg to the outside of your left leg. So we've got our right leg behind our left, crossed over. Forward fold here. Let your head hang heavy. We're going to bring our block. So you might use a different setting than me, but I'm going to bring it onto its lowest setting and plant your right hand down, left arm reaches up. Coming into a nice twist here. Option to bring the left hand to the right hip crease to open up further. Release your hand back down and uncross your legs, forward fold. Move your block out of the way. Inhale, halfway lift. Exhale, fold. And inhale, up to mountain pose. Well done. We're now going to do that on the opposite side with our surgical leg being the main support here, so that might be a bit more challenging this time. In different ways, challenging in different ways. All right, just going to adjust my brace, making sure it is where it needs to be. Coming into mountain pose. Start to shift your weight into your right knee and bring the left knee up, one-legged mountain. Find your focus here. And then we begin to bring our left leg behind us into warrior three. If you do have wobbles on your surgical leg, it might be helpful to have a wall next to you or a chair for extra support. We don't want to be falling over on our surgical leg. Lower the left leg down, coming into a high lunge. This high lunge on this side is probably not going to be as high as your high lunge on your other side, and that's okay. We're accepting where we are right now. One more breath, and exhale, opening into warrior two. Gaze over the right fingertips. Make adjustments as you need to strengthen the right leg and support the surgical leg. Inhale to reverse warrior. Open up the right side of the body. And back through center, warrior two. Straighten your right leg. And for me, I'm going to need to make a little bit of adjustments here still. So I'm going to shorten my stance into my triangle pose a little bit, and that's okay. We want the right leg to be supported and the knee to be supported, engaging our quad muscles to protect the bits of the knee that are still healing. So my right leg is straightened, arms are out long, reach forward with the right hand, and we come down into triangle pose. Again, option to use the block here for support. Inhale back up to warrior two, making adjustments with the stance if you need it. Start to make your movements forward, grabbing your block with your right hand, and we come into half moon. Stack your hips, left arm reaches high, left foot flexing behind you. Begin to shift your weight, your hips down facing towards the mat, coming into standing splits and being patient and accepting of where your body is right now. Bring a slight bend into your surgical knee if that's helpful to you. Inhale, Shiva squat. This squat is going to be less than the other side. Exhale, extend. Squat and extend. Shiva squat and extend. Well done. Bring your left foot behind your right. With the right foot in front, forward fold with the twist. Bring your block underneath the left hand and right arm reaches up. Option to bring the right hand to the left hip crease to open the twist. Come back down into your forward fold. Uncross your legs. Inhale, halfway lift. Exhale, fold. And inhale, slowly come up to standing mountain pose. All right, we're gonna do that one more time, this time matching up one breath to movement. So come to the top of your mat in your mountain pose. Hands to heart center. And start to shift your weight into your left foot. Right leg comes up. One-legged mountain. Find your focus. Shift your leg back into warrior three. Here for 3 breaths. Right leg gently comes down, high lunge. Exhale, protecting the right knee, warrior 2. Inhale, reverse warrior. Exhale, straighten your left leg, reach forward, coming into Trikonasana. Here for 3 breaths. Back into warrior 2 and to reverse warrior. Back through warrior 2, shift your weight forward, grab your block, coming into half moon. Taking a moment to find your balance. We'll be here for 5 breaths. If you're feeling good and want to challenge yourself, maybe you let go of your block and come into a full balance here for half moon. Rotate your hips, pointing down. Right leg extends up, standing splits. Inhale, Shiva squat. Exhale, extend. Shiva squat. Extend. Shiva squat. Extend. And this time we're just going to bring our right leg next to our left, forward fold. Inhale, halfway lift. Exhale, fold. And inhale, slowly come up to standing mountain pose. Here for 3 breaths. Inhale, arms come up. Exhale, hands to heart center. Shift your weight into your right leg. Left leg comes up. Here for 2 more breaths. And we start to shift forward, coming into warrior 3. Using the wall or chair for support as you need it. If it's not happening right now, that's okay. You can meet us in high lunge. Left leg lowers down, coming into high lunge. Feeling the strength in that right leg. Exhale, opening warrior 2. Inhale, reverse warrior. Exhale, warrior 2. Straighten the right leg. Adjust your stance as needed. Reach forward, Trikonasana. 3 breaths here. Inhale, back through warrior 2. Reverse triangle. Warrior 2. Shift your weight forward, coming in to half moon. Again, using wall or chair for support as needed. If you're feeling really strong and brave, you can always let go of the block, but that's not going to be in my practice today. 2 more breaths. Point your hips down towards the mat. Standing splits. Inhale to Shiva squat. Exhale, extend. Shiva squat. Extend. Shiva squat. Extend. Lower your left leg down, forward fold. Inhale, halfway lift. Exhale, lower. Inhale, come back up to mountain pose. Take a moment here. Noticing your body, noticing the difference, and starting to feel the strength and heat we've built up in our right leg there. You always have the option to do 1 or 2 more rounds of that if you'd like, or take an option for some child's pose, or resting on your back, since child's pose is probably not going to be very comfortable with a knee injury. All right, we're going to close off our practice now and just come onto the mat, back onto our backs. Feet on the mat, knees up, supporting your knee as needed to get here. Take your right leg, which is your surgical leg, and cross it over your left knee. Keep your foot flexed here. It's extremely important to keep flexion in the foot to keep protecting that knee. Take a moment to settle here in figure 4. Notice how you're feeling. If you're good, stay here. Option to begin bringing the left leg up to start stretching out the back of our leg here. This is tough for me here, so I'm not going to go any further. We don't want pain or any sharp feelings in our knees. If you're feeling that, it's very important to back off, bringing your leg back onto the ground. Lower your leg back down, uncross your feet. And maybe straighten out that leg for just a moment. Bring the bend back into your knees. And cross your left leg over your right knee, keeping a good flex in the left foot to protect the non-surgical knee. Last thing you want is to do damage to the leg that's actually okay. Take a moment settling here. And maybe you bring your hands behind your right leg to deepen the stretch in the left hip. Lower your right knee back down onto the mat, uncross your knees. We're going to windshield wiper them side to side. Bring your arms into a nice cactus shape, opening up your chest. And then when you're ready, we'll make our way into our Shavasana. It might feel nice to use a block underneath your surgical knee, just so it's not completely straightened out. So always have that option to include that here. It's also nice just when your knee is healed to give a bit of support and comfort. Hands can be on your body or out wide. Take a few moments here to focus once again on your breath before making your way into your day. I'll guide you through some short breath work to finish off our practice. Notice your lungs filling up with breath. Seal your lips and breathe in through your nose and out through your nose. Deepen your breath, filling up your lungs all the way through your diaphragm, your rib cage, and your chest. Exhaling out, chest, rib cage, diaphragm. Inhale in, diaphragm, rib cage, chest. Exhale, chest, rib cage, diaphragm. Inhale in, diaphragm, rib cage, chest. Exhale, chest, rib cage, diaphragm. Take a few more breaths in this pattern. And then return to your natural breathing. When you're ready, thank yourself for taking some time for your practice today, working your way back into your yoga, strengthening your body, your mind. Thank you for joining me. I hope to see you again.